For the purpose of this video, I'm going to use Alejandra to act as John. So we're going to start asking the questions and she's going to be responding as well. We're going to start right now. And how you doing, John?
I'm good. How are you?
Very good. My name is Maria Hernandez and I'm your occupational therapist. I'm here to complete a process of evaluations regarding your balance concerns. And the first thing that we want to do to complete or to start this process is to complete an interview. Okay? I'm here just to ask questions and please explain the best of your knowledge what are the concerns that you have. That way I can take notes and help you to create goals that can target the deficits that you're complaining about. Okay? So the first question that I'm going to ask you, John, is about your symptoms. Can you please describe your symptoms?
I've had difficulty with my balance for about 3 years since my retirement, and just it interferes with some of the things that I do in my daily life.
How does your condition affect those things that you say about your daily life?
I have difficulty, first off, doing the things that I typically used to do in the past. But one of my biggest concerns is my difficulty with dressing when I dress, especially my lower body. I have some difficulty with my balance. Also standing for prolonged periods of time, and when I'm taking a shower, especially.
Any other concern?
I'm very scared while walking for long periods of time, and just doing like my daily tasks around my home. Just my lack of balance is really affecting the things that I do and the quality of life that I'm living currently.
Okay. And what are your goals for therapy?
I used to do a lot of things before I started noticing that I had some difficulty with my balance. Mostly I want to just be able to get back to the things that I used to enjoy doing and feel comfortable, feel safe, and be able to understand and maybe find better ways to do the things that I'm doing currently, but without the fear
Of falling.
of falling. Yes.
Okay. Tell me about your occupation and what it entails.
I was an accountant for 40 years. I'm now retired for the past 3 years. So mostly I just do some tasks around the house. I like gardening and mostly just stay home, watch some TV, work on some puzzles.
At the moment, what are your hobbies or recreational activities?
Right now I enjoy doing puzzles. I enjoy gardening in my front patio. And I like to watch sports as well.
Okay. Do you have any concern or fears about your condition?
I'm mostly just scared of falling, and just the lack of balance that I have while doing the things that I'm doing. Making sure that I'm able to do them safely and not fall, to be able to avoid the things, falling while doing the things that I enjoy.
Do you have any concerns about therapy?
Mostly I just want to learn how to, not really concerns, I just want to find better ways to do what I'm currently doing.
Of course, I believe that, you're going to do that to decrease the opportunities of falling, right?
Yes.
Okay. Do you have any support system at home?
Yes, my spouse does help me with a lot of the things at home. Yeah.
John, regarding a support system at home, do you have bars in the bathroom that you can hold while you're taking a shower?
I do not.
You don't have that. So
No.
that might be something that we should think about it, okay? So I just want to put like a highlight right now, so we can talk about that when we finish, like at the interview. Okay? So
Okay.
the rails or bars around I mean, in the bathroom, in the shower. Okay? So if you feel like, because you told me at the beginning that you feel like when you're taking a shower, sometimes you feel like the balance is not there.
Yeah,
So
very insecure.
I think that, thinking about bars in the bathroom will alleviate a little bit, your concerns. So that will be something good, to address soon.
Okay.
Okay? The next question will be, how do you manage your pain, if you have any?
I currently don't have a lot of pain, but I do take medications in the morning. But currently, I'm not experiencing any pain.
Nowhere.
I have neuropathy in both of my feet, so I have poor sensation, so I don't feel a lot. But no pain really.
Okay.
No significant pain.
Okay. What is your current level of physical activity?
Just doing things around the house. I think gardening. I think is the biggest physical activity I do currently. For the most part, I try to avoid like activities that require a lot of walking and just for the fear of falling and the insecurities.
Do you have any other health condition?
Yes, I'm diabetic. I have hypertension. I also have high cholesterol, and as I mentioned before, I have neuropathy in both of my feet.
Okay. But I hear also that during the morning routine, you take your medication, right?
Yes.
To have
yes.
everything under control.
Yes, I take my medication.
So far, so good with all these issues, with your
Yes.
diabetes, with your blood pressure, and with cholesterol, right?
Yes.
Okay, perfect. So, what specific tasks or activities are most difficult for you to complete?
Dressing.
Okay.
Definitely when I get dressed in the morning, I have a lot of difficulty with that. I have a lot of difficulty for standing for a long time, for long periods of time. So I try to take like some rest breaks in between. And just lack of balance when walking around. Mostly when I'm showering, I have a difficulty with standing in the shower.
So you're telling me that you have a lot of difficulties with those things that pertain to yourself, to the care of yourself.
Yes.
Okay. How difficult is for you to complete the self-care activities? For example, bathing, dressing, eating.
Dressing, I have difficulty with balance, especially putting on my pants. In the shower, I have a lot of difficulty with just standing for a long time. And maintaining, that it takes a lot of exertion for me to stand for long periods of time.
You know what? Now, of course, I have to finish my report, but I will tell you that to decrease the risk of falling while you're getting dressed in the morning, my recommendation will be for you to do that while you're sitting down in your bed or in a chair. So that way you avoid the risk of falling. And also, if you're taking a shower, it might help to have in the bathroom a bench so you can sit down while you are taking a shower. So that, also will be something that it will be nice if we take care of that as soon as possible, okay? Have you noticed any change in your mood or mental health since the onset of your condition?
Yes, I have a lot of anxiety when just doing my simple tasks, and getting back to the things that I used to do. But yeah, I have a lot of anxiety because I'm afraid that I will fall, and and not be able to stand back up after I do fall.
How do you typically handle stress or anxiety at this moment?
Well, I refrain from doing a lot of things that I used to do in the past. I try to stay home and do a lot less of what I was doing before But yeah, just mostly try to stay home and to avoid going to crowded places and outdoor spaces where, I might have to walk um, for long periods of time. So mostly just stay home, watch TV, do some puzzles, and that's about
That is,
it.
that is a good way, like to handle stress or anxiety, just to avoid, to do those things that create, like a lot of anxiety, as you say, because you might feel like you might fall and, who's going to help you. But that is a good way, to handle that stress and anxiety. Reading, that is good. Watching TV, at least, those are activities that you can do by yourself without feeling like something is going to happen to you. What is more or less your typical routine?
I wake up in the morning, I get dressed, I take a shower, I take my medication, I like to do some gardening, and just do simple house tasks, things that don't require me to do too much activity, and watch TV, do my puzzles.
Are there certain times of the day when your symptoms are worse?
No, not really.
Because because you say that sometimes you take rest.
Yes, when I'm doing a lot of activities, when I'm doing outdoor activities, I do take more frequent rest breaks. When I'm doing a lot of tasks, when I'm standing for long periods of time.
Will you say that that is the time where the symptoms worse
Yes,
worsen?
yeah, I would say that.
Okay. How does your condition affect your ability to participate in social activities?
I try to avoid them altogether. Mostly just to avoid falling. Really, I used to do a lot more activities, and now I kind of just like to stay home and avoid things that require too much of my, too much standing or too much walking.
But would you say that your condition changed the way of you doing what you used to do before?
Yes, yes. I used to love to play golf. I used to play cornhole, and now I just for fear of falling, and I don't participate in those things as much as I used to before.
Have you ever had occupational therapy?
No, I have not.
Okay. Do you know what is occupational therapy?
Not really.
Okay. As occupational therapy, what we do, John, is to help you to regain those abilities that you might feel like they're not there anymore, and to help you engage in those activities that you love. Occupational therapy is going to help you to feel comfortable, to regain those skills that you need to participate in those activities that you love. How confident are you in managing your condition?
I'm pretty confident. I just have a lot of fear, so I would like to learn a little bit more on how I can learn how to take care of myself and to avoid potential falls in the future, and really try to do as much as I can and the things that I enjoy doing without having constant fear or anxiety.
Of falling. Okay, John. I don't have any more questions for you at the moment. But the only thing that I can tell you, based on the information that you give me, I will give you maybe simple recommendations to start doing those things as soon as possible, just to avoid falling. I hear that you don't have bars in the bathroom. I will recommend you to think about that, because if you're doing the showering by yourself, it will help you if you feel like you're losing balance, to hold yourself on the rails, and that way you can keep the balance. Or also in the bathroom, you can have a bench where you can take a shower while you're sitting down. I think that is not, it's not in a big investment, but it will help you to complete those things by yourself without the risk of falling. Also, one of the things that I will recommend you is to wear proper shoes that avoid you to sleep. So I mean, that's is something that you need to, like, don't wear sandals or flip flop, because you can fall using those type of shoes. So my recommendation would be like a non-slip shoes. That will be something for you to do as soon as possible. And taking breaks while you're doing activities, that is also good, because keep you calm. Sometimes when we feel like we're doing a lot and we don't rest, we might feel like, hey, it's too much for me to handle, and anxiety can arise. So if you can keep doing what you're doing, taking breaks, I think that will help a lot.
Okay.
Do you have any other question for me right now? Remember that we have to complete other assessments for me to to have a better idea of what are the strategies that we want to follow and what are the goals that we want to complete. But I want you to know that based on the information that you're giving me, I'm going to just make sure that those things that you love to do, you're going to be able to keep doing it. Because our goal is for you to regain and to feel comfortable as before. Going out, play with your friends, enjoying golfing, walking, and doing those things that you feel like you have a lot of joy and that you value a lot.
Okay.
Any question?
I think you answered a lot of my questions that I had. Mainly my fear and my anxiety. So.
But for the meantime, like I say, dressing, sitting down in your bed or in a chair, maybe having a bench in the bathroom, and the rails and the shoes. Very important, the shoes. Okay.
Thank you.
So nice meeting you, John.
Pleasure.
And I hope to see you soon
Yes,
to
I'll see you
complete the
soon.
rest of the assessment. Thank you.
Thank you.
Thank you.